If you're listening to this, chances are you already know how emotional it can be living with type 1 diabetes. It isn't just about managing blood sugars, it's also about managing how it feels. The constant decisions, the ups and downs, the pressure to get it all right, it can really be a lot. But emotional resilience isn't something you either have or don't. It's actually something that you can build. My name is Scott Johnson, and today I'm joined by Kathryn Ward, a licensed clinical social worker with Blue Circle Health who works closely with people living with type 1 diabetes to help address some of these emotional challenges. But before we continue, I need to remind you that we're not providing medical advice. For personalized guidance, we'll always encourage you to consult your healthcare team. Additionally, Blue Circle Health does not endorse any specific product brands and encourages you to discuss those details with your personal healthcare team. Kathryn, I'm really glad you're here. Thanks for joining me today.
Yeah, thank you so much for having me, Scott. I always enjoy these conversations so much, so it's a pleasure to be here with you.
Thank you. Yeah, and this is such an important topic. I know it's something that a lot of us struggle with. In your day-to-day work here at Blue Circle Health, you work closely with people living with type 1 diabetes, often on the emotional side of things. And when you think about the people that you support, what are some of the most common emotional challenges that you see?
That's a great question. I see quite a few, actually. One that I see pretty frequently is anxiety. So anxiety about potentially being unsafe or embarrassed in the event of a low blood sugar, or, worry about being able to access insulin and supplies in the event of employment or insurance loss. I see fear over what the future may hold in terms of complication risks or, implications for just, feeling like a burden on others, on family. I see sadness and grief. Sometimes this is, again, tied up in that piece about feeling like a burden to loved ones. Other times, especially in instances where diagnosis is more recent, there's really big grief over, the loss of a life that someone knew before, over maybe a lack of spontaneity or freedom to just eat a meal and go out dancing and not having to think about blood sugar implications. I think I see a lot of exhaustion, emotional and cognitive exhaustion. There's glucose management fatigue, there's alarm fatigue, there's fatigue around navigating a really complicated healthcare system. I see a lot of people who feel pretty isolated because of their diabetes. And, the majority of human beings who don't actually live with type 1 typically have a pretty hard time fully appreciating how burdensome it can be. I could go on at length about the emotions, but those are some of the big ones that I see.
I think that a lot of us and a lot of people without diabetes assume that managing diabetes is mostly about the numbers and decisions. But as you described, there's so much more underneath that. How do you help people start to recognize and make sense of what they're feeling? They maybe haven't even had the chance to process and articulate those thoughts and feelings to reach a point where they can start working on it. What are some of the first things you do with someone?
Yeah, I appreciate that question so much, Scott, because it's really important, that piece about being able to identify what's happening emotionally here, because there are so many moving parts, and it is often, I think, difficult to fully articulate the emotional complexity because T1D touches everything. And I think for me, what is useful, and I think for the people that I often talk to, is we use the diabetes distress assessment scale here. And that helps sort of capture some of the emotional aspects of diabetes. And, it's a tool that kind of helps us understand the different pieces and then have a conversation about, okay, how do those pieces in the puzzle fit together? So the DDAS can help identify, is there shame here? Because someone might not readily identify or articulate that. But then in responding to an assessment, go, oh, actually, when we start to have a conversation about scores, say, you know what? There is actually some shame here, and it's tied up in stigma, or it's tied up in worrying that, if I'm at a party and have a low blood sugar, I'll feel embarrassed, or those sorts of things. And, we can even have a conversation about, okay, how do these different sources of distress or these different emotions kind of influence one another, right? So, for example, if someone has a lot of anxiety about hypoglycemia, often for good reason, I think that some level of anxiety about low blood sugar is really adaptive and important. And what happens sometimes, I think, particularly in the context if someone has had a really frightening low blood sugar or felt really unsafe, is that in order to start feeling safe, they may change the way that they manage diabetes just to feel safe, right? And so maybe there's a little bit more hyperglycemia because of that, because they're trying to feel safe in the moment. And then so there's anxiety around hypoglycemia. And then that also touches into anxiety about, well, what does this mean for the future? Am I trading long-term safety in the sense of, am I increasing my risk for things happening for the short-term safety of wanting to feel safe right in this moment, and it's complex. So I think that that's one tool that for me, I find helpful to be able to tease out some of these emotional nuances and how they overlap and inform each other.
You mentioned the adaptiveness of feeling some anxiety around low blood sugars, and you expanded on that a little bit. But that also really hits home for me too. I remember, gosh, it's probably been 15 or more years now, but I had a severe low blood sugar after basketball where I passed out at a restaurant with my friends, and it really rocked me. I went through a significant period of time where I was running higher just because I was afraid. And can you talk a little bit more about that? You used a phrase like adaptiveness or something around those. I'm not getting it quite right, but you mentioned that it is healthy to have some level of anxiety around low blood sugars.
Yeah, absolutely. And maybe anxiety, I think maybe awareness or really cautious awareness might be a more useful way to frame it, right? Because anxiety, I think anxiety, as human beings, we all experience anxiety. Like it's part of the way that we're hardwired. We have these really complex and wonderful brains that have evolved to help us stay safe. And what can happen sometimes is, anxiety will arise, really for good reason to help us stay safe. And then I think if it's a really frightening situation, we may sort of adapt a response that's maybe driven by sort of a more of an autonomic nervous system response where we're sort of feeling a little bit of maybe a fight flight or not feeling safe, so that when the anxiety arises, might feel like a threat, right? So that our brains do a great job, I guess, of alerting us to potential threats. I think that our brains don't always do the best job of parsing out real versus perceived threat. And I think particularly in the case of like a traumatic event, there is a nervous system response that kind of gets wired into like, hey, I'm going to do what I need to do to stay safe. And so that doing what I need to do may be, maybe using a little bit more carbohydrate than is needed to bring up a low blood sugar, or maybe responding to what looks like it might turn into a low blood sugar before it actually does. And again, all coming from this place of wanting to stay safe. So I think that's the piece, right? And this gets really tied into, I think, emotional awareness, which is a huge part of emotional resilience, right? Is like when that worry comes up, is allowing it to be there and to be what it is, and really kind of taking a step back without letting it sort of drive the train or drive what we do. And I think that's where a lot of us as human beings get a little bit stuck. And it's just what happens, right? So sometimes it's a matter of sort of unlearning, right? Or being able to identify like, okay, there's anxiety here, and the threat is not as big as my brain is telling me it is. My brain's really just working hard to keep me safe. And right now I'm actually pretty safe.
When someone's really in it, when they're feeling overwhelmed and frustrated, maybe even burned out, what might that tend to look like for them in real life?
So I think it can show up in a few different ways. We tend to think about, okay, if someone's feeling burned out, maybe they're more disengaged or feeling like I just don't have the energy right now for diabetes, right? And so there's a sense of maybe feeling like I'm just going to do the minimum or whatever it is to manage blood sugar. And certainly that's one manifestation. I think it can also show up as like hyper engagement, right? Or feeling really focused on numbers, maybe to the exclusion of everything else that's happening in life, and maybe micromanaging diabetes, again, just to feel safe because there's this overwhelm or this underlying sense of this is what I have to do to be okay. And, that the latter one may have benefits in terms of time in range or A1C, but it can also come at a tremendous cost. If that's where sort of all of the attention and effort is focused, or it might come at the cost of restricting meals that someone really enjoys or activities that they may love. So I think it's both, and they're kind of two sides of the same coin.
If someone's listening to this and they might be thinking, oh my gosh, yes, that really sounds like me on either side of that coin, right? What do you want them to know right away? Like before we even get into more of the tools and things we're going to talk about in a minute, like let's give them an early takeaway right now. What do you want them to know?
So I would want them to know that burnout is normal. Overwhelm is normal. I'd want them to know that diabetes distress is extremely common. Diabetes distress is not a mental illness. It's not a sign of weakness. It's actually an expected response to this full-time job of being a pancreas. And this is a job that nobody's getting a vacation from. Nobody's getting paid for this job, right? It's a lot. And I think I'd also want them to know that they don't have to be perfect to live well with diabetes.
When people start to understand that it's part of the experience and not necessarily a personal failure, which I think many of us, myself included, would tend to think of it in that way until we can sort of wrap our brains around it in a little better way. What tends to shift for them when they start to understand this is a normal thing to go through?
I think just more ease in those really tough diabetes moments, right? There's a capacity to kind of zoom out and see that, all right, this is a piece of data. This is a moment in time that might be impacted at this particular moment by any number of variables, right? And so this piece of data at this moment in time is simply that. It's not necessarily a reflection of someone's self-worth, not even a reflection of their effort necessarily. I mean, there are so many things that can impact blood glucose management.
A phrase that I hear you use a lot, and it's a phrase that I really, really like, and that is emotional resilience. And when you think about that phrase, what does that actually mean in the context of living with type 1 diabetes?
Yeah. So I think it's really tied up in acceptance. And I would like to really take care and sort of distinguish acceptance from resignation. Like, okay, well, this is just what it is. I think acceptance is about fully acknowledging and allowing difficult emotions rather than feeling like, oh, this is painful. Let me see if I can push it down or get away from it. Or letting those difficult emotions drive the bus, right? So I think the emotional resilience starts with that allowing and accepting, which starts with, first of all, emotional identification, right? So it's tough to build emotional resilience if we don't have the capacity to first identify the emotions, to normalize the emotions, and to allow and acknowledge that emotions they're part of it. They're part of being human, and sometimes they're going to really hurt. But we don't necessarily have to give our power to emotions in the sense that we have to get away from them or that we have to let the emotions dictate what we do.
When you talk about accepting and acceptance, I think of myself in that it's a repetitive process that I have to go through. I don't feel like I've ever reached a certain point or a landmark in my time with diabetes where I've accepted it. It's like I'm accepting of it right now, but as soon as something happens that maybe throws me off track, or if I'm having a particularly hard day, week, or month, or whatever it is, I kind of have to go through that process of reaching acceptance again. It doesn't
Mhm.
feel like a one-time thing for me. Is that fairly common too? What do you think about that?
Yeah. Oh, Scott, that is such a beautiful point and so insightful. Absolutely. Acceptance is a journey. It's not a one-time thing. I mean, if there's one thing that human beings are guaranteed is that difficult things are going to arise. And certainly if there's any guarantee in the T1D journey, is that things are going to shift from day to day and they're going to be hard days. And that I think acceptance, like if you think of acceptance, kind of what you're getting at in the larger sense, I think the acceptance is that, okay, there are going to be hard days as part of this journey. And then absolutely from day to day, there's that acceptance again and again and again. Right now, this blood sugar doesn't feel safe. Okay, this is a moment in time. How do I slow down, nurture myself in this moment and, take care of the blood sugar in a way that's going to keep me safe? Um, how do I slow down in this moment, show up with kindness, with self-compassion, rather than maybe showing up as the inner critic around that number, whatever it is, that acceptance. Absolutely. I think happens again and again and again. It's really part of mindfulness, I think, Scott, is recognizing what's arising in the moment and allowing it.
I love that. So I'm being more mindful than I'm giving myself credit for. That makes me smile.
I think so. I think that you're very insightful, Scott, and absolutely. Yeah.
It's because I get to spend time with people like you. So thank you, Kathryn. Let's
Well, of
let's go
course.
back to that word resilience. I think a lot of people hear
Mhm.
that word resilience and they assume that it means, I don't know, being strong all the time or just pushing through the hard things. What are some of the misconceptions like that you see about that concept of resilience?
Yeah, yeah, that's another super insightful point. And it's exactly that. There's almost like gets sort of conflated with this idea like I've got to pull myself up by my bootstraps. If I start to feel sad, I need to shut that down and just keep on plugging along. It's almost like this sort of tough coach mentality that like, if someone allows themselves to feel frightened or sad, that it means that they lack grit or mental toughness. And it's actually, I think it's really the other way around, Scott. I mean, being able to allow painful emotions, without feeling like, okay, I got to get away from this, or without feeling like, okay, they're going to drive the train, that's where we start to take our power back, right? So it's about acknowledging, okay, this is here, it's uncomfortable, breathing into it. That's where we build the resilience, right? Is really allowing ourselves to get down into it. I think, another piece that sometimes gets tied up with that I think speaks to this is that I've spoken to people sometimes who will say to me, well, I feel like I have to be hard on myself to stay motivated. Like if I see whatever the number is, if I see this number, I, feel like I have to remind myself of all the terrible things that can happen and really kind of, they show up, the inner critic kind of shows up, loud and harsh. And that's exactly what that is. I mean, that approach tends to show up as self-criticism or emotional avoidance, and it's not a sustainable way to cultivate emotional resilience or self-compassion, which I think is a really essential piece when we think about emotional resilience.
And I love that you talk about resilience and emotional resilience as something that you are cultivating and building. And it's not something that you either have or you don't, or you can flip a switch and it's there for you, or it's not. It's something that you have to kind of nurture and cultivate and build. When someone is building emotional resilience, what might start to look a little bit different for them in their day-to-day life with diabetes?
I think that often can show up as more ease. Again, that sort of recognition that those tough days are part of the journey. And then with more of a sense of ease, there tends to be more self-compassion, and self-talk might shift from sort of self-criticism to self-kindness. And that self-kindness piece, that's one of the primary pillars of self-compassion. So being able to show up with some gentleness and, not some psychological flexibility is another term that I find useful, right? So it's the capacity to show up to a moment however difficult it might be, and not get completely derailed by it, not letting that difficult moment define, someone's self-efficacy, their self-worth, their overall experience with diabetes. It's a capacity to recognize, again, this is a moment of time. In the grand scheme of things, I'm doing okay.
All right, that's great. Let's take a quick break here. When we come back, I want to bring this into real life, what this actually looks like day to day, and how people can start putting some of these ideas into practice. One of our favorite things is sharing stories from people who've participated in the Blue Circle Health program. And I have one here from Liliana in Florida, who's been living with type 1 diabetes since 2004.
I was 6 years old, so I've been type 1 diabetic for 22 years now. I was the first one in my family to be diagnosed. My parents were so amazing with just trying to learn and be there the best that they could for me. I didn't have access to a lot of endocrinologists, so I just kind of went to the one that was at my local hospital, and wasn't the best experience for me either. They really took the approach of scaring me. I think it just pushed me a little bit more to resisting the diabetes versus wanting to tackle the issues. So went to the Blue Circle website, basically was like, please sign me up for everything that's available, the counseling, the endocrinology, the insurance checker, the peer, like anything that is available to me, I would love to sign up for. And all of it was absolutely phenomenal. I mean, cannot say enough amazing things about the organization. Appointments with Dr. Gomberg and the kind of like mindset shift of realizing that like I do have the tools to care for myself has been life-changing. I now feel really empowered that I know myself, I know my body, I know my trends enough that like, yes, I can make those changes on my own to make things go better for me. And I think just having the skills, the tools, the confidence to make those changes and care for myself has been life-changing for me.
Thank you, Liliana. Stories like that are such a powerful reminder that this isn't just about numbers. It's about how all of this feels. And with that in mind, I want to share a resource that I think is worth knowing about. This isn't an ad or a paid sponsorship. It's just something I've come across that I think might help. It's a section on the Beyond Type 1 website focused on mental health and type 1 diabetes. They've pulled together articles, personal stories, and practical insights around things like burnout, stress, and the emotional side of managing diabetes. If today's conversation is resonating with you, this is really a good place to keep exploring and find support that meets you where you are. You can find it at beyondtype1.org, then click on the Beyond Type 1 drop-down menu, and look for mental health and type 1 diabetes under the Living with Type 1 Diabetes header. Welcome back. We've been talking about the emotional side of living with type 1 diabetes and what it really means to build emotional resilience. And Kathryn, I'd love to spend the rest of our time making this as practical as possible. So if someone's listening and they're thinking, okay, this all makes sense, but I don't know where to start, what's one small, realistic first step that they could take?
One thing that I think can be helpful is to pause and just gently shift and acknowledge, like, okay, what's going well? When I'm first meeting with someone, I'll always ask, like, how do you identify your strengths related to your diabetes? And sometimes people have a really hard time with this, and they feel like, oh, I don't feel like I have any strengths, or they're kind of stuck in a place of feeling like they're just not getting it, or just having a really hard time. And when they shift, then I might maybe just bring some acknowledgement to their willingness to show up to this appointment, which is an appointment where they might, become emotionally vulnerable, which is scary for a lot of people, and really just reflect on the courage, and the time that they've carved out. And then maybe from there, recognizing like how many small moments in the day do they carve out the time to take care of themselves, whether it's to show up to an appointment or to go to the pharmacy or to do whatever it is. And, sort of just shifting that lens, seeing just those small moments, it leads to recognition sometimes that actually it's a big thing. There's a lot of things that, that someone's doing right. And I think too, that if someone's really struggling to connect with a strength, or feel like I feel just really kind of stuck with this question, kind of going back to that self-kindness aspect of self-compassion, right? And even if that means offering the intention of kindness, right? So if someone is really finding themselves sort of, stuck in a spiral of self-criticism or, I'm not going to get this right, is even just offering the intention, if it feels sort of inauthentic to say, I'm doing these things well, to say something more along the lines of, okay, may I be gentle with myself, or may I be kinder, may I one day recognize my deservingness of kindness, of compassion. So even just those baby steps to start to shift that narrative from one of sort of self-criticism or self-judgment to one of self-kindness.
Let's maybe dig in on that a little bit more. I love that concept so much. And if someone's having, they've had a tough day or even a tough week with diabetes, we need to find a way for them to sort of reset and move forward without getting stuck in it. How might you address that?
So I think another, pretty important component of that is mindfulness, right? Because a lot of times when we're feeling kind of stuck as human beings, there's this feedback loop that happens, right? And so the thoughts start to get really automatic, and so someone might be, kind of perseverating for 20, 30 minutes before they even realize, right? Because there's this sort of default loop to like, I'm effing up or whatever it is, right? So that mindfulness piece, really kind of slowing down and noticing, okay, what's coming up right now? Like, what am I actually thinking? And kind of taking a step back and getting curious, with absolute non-judgment about sort of the narratives themselves, right? Because thinking is something we all do and our minds get really busy, but being able to step back and look at, okay, what's the narrative there and how helpful is it? And that's just a matter, in the moment, just bringing curiosity and non-judgment in the moment to, all right, what are my thoughts doing? What's happening in my body right now, right? A lot of times, emotional difficulty will show up as physical sensation, right? So anxiety might show up as fluttering in the chest, or grief might show up as tightness in the throat. So really allowing oneself to just settle and connect with, okay, what's the somatic experience right now? And a lot of times when we slow down and do that, I know for myself included, like I'll realize, oh, my shoulders are up here. I'm so tense, right? And so I'll recognize, like, where am I holding on? Where am I gripping? And just to be able to slow down and just notice. So even that slowing down to notice is a real act of self-compassion, right? Because you're allowing yourself to see, like, okay, this is what the typical sort of storyline is. And it takes practice, certainly. It's not something that we do automatically. But small moments of practice throughout the day. And I think that our emotions can be a wonderful sort of cue as to when it would be helpful to practice. Because, when we get caught in a really big wave of emotion, that's an opportunity, we tend to notice it, and it may be that there's been a sort of a self-critical narrative that's been going on for the past 45 minutes, but then there's this sort of big emotional wave, and maybe that's the opportunity to pause. And the more that there's an opportunity to really make contact with the internal landscape, again, from a place of non-judgment, right? So you don't have to give yourself a hard time for, having negative thoughts or whatever it is. It's just you're just noticing, almost like you're watching, characters on a TV screen and just seeing it, but seeing kind of what that does to your emotional experience and slowly kind of making those shifts towards self-kindness.
How might someone start building these habits over time without it feeling like, oh boy, here's just one more thing I need to manage. Here's one more thing I'm not good at yet. How do they start to build these skills without it feeling like just one more thing?
I think starting small is really impactful. You talked about that one deep mindful breath. If you do that 4 times a day, it's what? Maybe 9 seconds of your day, but it's actually 4 seconds of your day where you've actually intentionally kind of said, I'm going to override my nervous system here. I'm going to take a deep belly breath and send a strong signal that, okay, I'm actually safe. There's no threat here. And building on small things. I think sometimes when, people think about, okay, mindfulness or slowing down or noticing internal narratives or working with that, they think about, okay, I have to sit down and meditate for an hour and stop my thoughts. And really, it's just about noticing, right? So it's the quality of attention that we bring. So it's showing up to the moment as it is with kindness, with curiosity, with non-judgment, right? You don't have to necessarily stop thinking about all the thoughts that you're having. You can just notice like, wow, look at where that screenplay went. And just see it with curiosity and recognizing, okay, this is just part of the human experience. And that can happen in just small moments, right? Sort of dropping in, settling in, allowing what's coming up and not judging it.
I think curiosity is one of the most valuable tools in diabetes and probably life in general. So I love that.
I think
love
so
that
too.
answer. When someone does start to shift how they respond, they've worked on this, they've built themselves up to a point where they're responding maybe with more self-compassion and awareness. Talk about what difference that might make for them over time and what that looks like.
Yeah. I think it goes back to that sense of ease, right? There's a capacity to see the big picture here, right? And the capacity to see that, okay, this particular blood sugar number or this emotional difficulty, this is a moment in time, right? These are kind of waves in the ocean, right? And the person experiencing them is actually the emotion or the ocean itself, right? So, there's a capacity to not necessarily be defined or carried away by these sensations, right? There's a willingness to accept that, okay, this is a tough diabetes day. And in this moment, this is really hard. And so I'm going to breathe in and, and I'm okay. It's in the grand scheme of things, I can kind of zoom out and recognize that this is a tough moment, not necessarily a tough life.
It's great. If you were to want someone who's listening, maybe they're struggling with the emotional side of diabetes, what's one thing you would want them to remember or take away from this conversation?
I'd want them to remember that difficult emotions are normal. They're not dangerous, and that they're part of the human experience. I want them to remember that it's okay to have hard days, that they all have them. And there's this aspect of self-compassion that speaks to shared humanity. And that's this sense of, in times of difficulty, we often feel kind of isolated or alone or like, oh, this is such a painful feeling. I don't think others can relate. That shared humanity piece calls for sort of stepping back and recognizing that, okay, this difficulty that I'm feeling, other people feel this too, right? It's almost a sense of we're in this together, sort of same boat, again, sort of normalizing painful emotions is just part of being human and actually something that connects you to other human beings. I think also, letting them know, I'd want them to remember that hard days don't define their value as a human being. Tricky blood sugar numbers don't reflect their effort or their self-efficacy. They're part of the journey, and be kind to themselves. I can't emphasize self-kindness enough. That's my favorite thing to talk about. One of them.
I love that. And just talking with you, you kind of radiate this self-kindness about you. So it makes me feel more kind to myself just spending time with you. So
thank you, Scott.
Yeah. Well, Kathryn, thank you so much for taking time to talk with us today. I really appreciate it. And I am quite sure that someone out there listening really needed to hear this today. So thank you.
Wonderful. Thank you so much for having me.
Thanks so much for listening today. One thing that really stood out to me in this conversation is that emotional resilience isn't about getting it right all the time. It's really more about how we respond and how we talk to ourselves when things don't go as planned. If this conversation was helpful, consider sharing it with someone who might need to hear it today, and we'll see you in the next episode. Until then, keep living well with T1D.